All right, good morning, everyone. Thank you for coming. I'm Dr. Maura Rossman. I am the health officer for Howard County Health Department. I will be your MC for today's event and also provide some talking points. But first, I want to introduce you to our great county executive, Dr. Calvin Ball, who is a great supporter of the health department, and you will hear sort of enabled this project to come to fruition. So, Dr. Ball.
Thank you so much, Dr. Rossman, and thank you all for being here today to talk about this much needed, innovative initiative for our moms-to-be. Howard County is one of the healthiest communities in our nation, but we still have challenges to address, and we will not rest on our laurels. Hispanic mothers in Howard County are 4 times more likely to receive insufficient prenatal care as white mothers, putting their health and the health of their babies at risk. The preterm birth rate for black women is 43% higher than all other women. It's unacceptable to me that incidences of severe maternal morbidity has slowly been increasing in the United States since 2019. And it is absolutely unacceptable that in the United States, one of the richest countries in the world, we are experiencing an increase in maternal deaths. In a recent study done of the 6 birthing hospitals in Maryland, researchers found that over 30% of all maternal deaths were preventable. Last year, we took a big step here in Howard County in providing maternal care through a transformational $1.3 million in investment of county funds to ensure vital prenatal and postpartum care is available and affordable for our underinsured and uninsured moms. And this year, we provided another $1.7 million in county funding to help provide more access to quality prenatal and maternal health care. We also provided $1.75 million in American Rescue Plan funds to Howard County Health Department to support additional initiatives like the Perinatal Equity and Care for Everyone, or PEACE project, which we're here to launch today. The PEACE project aims to provide clients, families, and healthcare professionals with essential information about prenatal, postpartum, and infant resources offered in our county. The Howard County Health Department conducted focus groups on childbearing-aged residents and found a general lack of awareness of pregnancy resources available in our county. The participants expressed a desire to have more one-on-one opportunities to talk with professionals. The PEACE Project Care Navigator will do exactly that. The role of the navigator is to help clients find which services they need and connect them with those services. This will be a free service for all pregnant and postpartum residents here in Howard County. This program builds on our efforts to provide reproductive health care at Howard Community College because we know that we must prioritize reproductive care for all women and their families. Our innovative PEACE project will truly be life-saving and a national model. We will help uninsured and uninsured women access care and overcome obstacles. According to the Center for Disease Control and Prevention, babies of mothers who do not get prenatal care are 3 times more likely to have low birth weight and 5 times more likely to die than those born to a mother who got care. We cannot and we will not be complacent while these disturbing trends rise, and this is an important step in building a healthier community, not merely overall, but for all. I'm confident the Peace Project is a giant leap in the right direction to protect our current and future generations. And I want to thank each and every one of you who are helping to make this vision a reality, who are helping to ensure that all of our mothers and babies know that they are seen, they are heard, and they're cared about. Thank you so much.
Thank you, Dr. Ball. I want to thank Dr. Ball for his foresight to invest in our future by supporting reproductive, maternal, and infant health in Howard County. The introduction of the Peace Project will provide a streamlined process for our community members to access prenatal, postpartum, and infant resources in the county. This program not only serves pregnant individuals, it serves everyone, because the goal is to have healthy babies, and healthy babies are an investment that pays dividends for everyone. I'm excited that we're able to offer access to this new program to all birthing people in Howard County at no cost. All you have to do is complete the form on our website or call our care navigator to receive a personal assessment and a warm handoff to the resource or service that will best meet your needs. Some examples include assistance locating a healthcare provider or lactation specialist, accessing emotional mental support resources, locating childcare, locating financial assistance or health insurance, or finding parenting support. Even in Howard County, an area of high educational attainment and high income levels, health disparities exist, including poor outcomes among babies and individuals of color. These outcomes can include preterm births, life-threatening conditions, and complications for labor and delivery, and as Dr. Ball said, this is unacceptable. Poor outcomes are especially apparent among Black women. In Maryland, Black women experienced a preterm birth rate 43% higher than the rate of all other women. This is true across all social levels, regardless of income or educational level. Ensuring access to prenatal care from a culturally competent provider, ensuring access to doulas and other community-based services, support for mental health, financial security, and parenting support are all evidence-based strategies to improve birth outcomes and make sure no one feels or is left behind. While pregnancy and labor and delivery are high-risk times, the majority of pregnancy-related deaths actually occur between 1 week and 1 year postpartum. It is important that postpartum care is accessible and culturally relevant for everyone who has given birth to ensure better outcomes and reduce the disparities. I encourage anyone who is pregnant or recently gave birth to consider the services that are available through this program. Let's be real. I know as a mom and a pediatrician, pregnancy, labor, childbirth, and taking care of an infant is not easy. And for some people, it's deadly. Don't wait to ask for help if you are not feeling well physically or emotionally. You may find that there is a class, support group, or specialist who can help you in ways you never dreamed possible. Lastly, I want to acknowledge the people who actually do this work, the staff of Howard County Health Department, and you can stand up, who work passionately to plan and operationalize this program. It's also not easy to do this. Your passion and your strength make a difference, and you are saving lives. Thank you. Next, I want to introduce Mr. Anthony Wisniewski, who is the Board of Health Chair. Lots of notes, sorry. Mr. Wisniewski is the chairman of the board of Levanta LLC, a Howard County-based company. It is the largest Medicare quality improvement company in the United States. Mr. Wisniewski.
Good morning. The responsibility of the Board of Health is to advise the county executive and the Secretary of Health about the conditions of the health of Howard County. As you have heard today, pregnant people, particularly those of color, experience poorer health outcomes regardless of education and income levels. The Board of Health is committed to supporting the programs and initiatives to sustain the health of our county's pregnant residents, our youngest and most vulnerable residents and their families. We applaud the foresight and financial commitment of County Executive Ball that he has provided to make the Peace Project a reality. With this project, our health department will be able to improve the health outcomes for babies and their families, one pregnancy at a time. Thank you.
Thank you, Mr. Wisniewski. Next, we have Ms. Nayani Enriquez, who is our Peace Project Coordinator and making these things happen.
Good morning. The Health Department is excited to launch the Peace Project. Our goal is to partner with the community to provide clients, families, and healthcare professionals with information about prenatal, postpartum, and infant resources available in Howard County. Care coordination improves communication between families and providers. Has been shown to reduce disparities in adverse pregnancy and postpartum outcomes. The goal of the Peace Project is to bridge the gap and actively link pregnant and postpartum people to community resources that can support them during and after their pregnancy. We've all heard the saying, it takes a village to raise a child. And although the adage is old, in the wake of the COVID-19 pandemic, it feels more relevant and urgent than ever. In launching our care coordination services, the Howard County Health Department is hoping to combat the deleterious effects of stress and social isolation that has been consistently found to have negative outcomes for mothers and infants. Care coordination is rooted in community building. By connecting pregnant and postpartum people to resources, we will learn about their health, personal needs, strengths, and wants. We will respect and honor the choices and ideas of our clients, provide support for those choices and ideas, and educate you on the resources available in our community, and provide connections to those services. This is the time to focus on community care. Community care is using our power, privilege, and resources to reach people. Community care is the foundation of unity. By cultivating it, we are better able to support our own self-care and that of our loved ones. This is why the Peace Project strives to build and connect communities, so people are aware of the resources that are available and accessible to them. We cannot do this work without you. One way we amplify the voices of our families is by utilizing community doulas. Community doulas provide person-centered care by meeting families where they are. Doulas provide families with education, advocacy tools, and emotional support during their prenatal and postpartum period. As part of our efforts to improve maternal and infant health outcomes, we have partnered with Mom Cares to improve awareness and accessibility of doulas in Howard County. Again, I'm excited to hear from the community, and we cannot do this work without you. Thank you.
And lastly, we are going to hear from Anna Rodney, who is a practicing doula for a long time. I won't say how many years. And she's also the founder and executive director of Mom Cares, which you just heard about.
Greetings, everyone. My name, again, is Anna Rodney, and I'm the Executive Director of Mom Cares. But 8 years ago, I was a single, overweight, Black mother with a child in the NICU. I was not expecting to be in the NICU, and at the moment of him being born, my first thought was, I'm a doula. I can handle this. I have a community that can help me. But what I found through our 6-month stay was that I was constantly battling my own issues, my own morbidities, my son's morbidities, and also institutionalized racism and implicit bias in the medical structure. These instances are what led me to create Mom Cares. Mom Cares is an organization that uses a 3-pronged approach of community education, direct service, and advocacy to support Black women and people of color throughout Baltimore City and now Howard County. We are excited to join with the Peace Project in the Howard County Health Department to be able to provide doula trainings and education so that we can create a representative population of those who are needed as far as doulas and compassionate care is concerned in Howard County. We have high hopes of being able to continue to correct the crisis of the maternal mortality crisis here in Maryland and beyond. And we're excited to lock arms and link to create more opportunities for compassionate, informed care for families throughout the county. Thank you so much.
Thank you, everyone. That concludes the media event, and we are taking some questions if there are any. We covered it all. Thank you very much for coming, and enjoy the rest of your day.